Ich bin heute Morgen eingeladen bei Dr. Ruiz und ich bin sehr dankbar dafür und freue mich sehr darauf. Es sind doch einige Fragen entstanden, die mich jetzt wirklich stark beschäftigt haben während dieses Treatments, was wirklich eine erstklassige Option ist. Und ich habe mich hier wahnsinnig wohl gefühlt und ich bin sehr froh, dass er sich heute für mich Zeit nimmt. Dear Dr. Ruiz, thank you for giving me the opportunity for this interview.
It's a pleasure.
Since when has HSCT been available in Mexico?
Well, the first transplant that I conducted was in 1993. I started doing transplants for persons with hematological diseases. This is multiple myeloma, lymphomas, leukemia, and so on. And later on, I decided to give persons with multiple sclerosis HSCT as a treatment.
Wow. How many patients have you treated as of July 2024?
We have done up to now, since 1993, 2,094 patients.
290. Wow.
Out of this number, 1,674 patients are persons with multiple sclerosis.
Thank you so much. What is the patient capacity in Mexico per month and only for the MS patients?
We have a special building which we call the Center for Outpatient Residents that allow us to graft around 20 patients with different conditions here in Puebla, and around 10 more patients in our facility in Monterrey, another city located in the northern part of the country.
Thank you so much. So I understand you right at this point. This is only the opportunity per month for 30 people with MS to be treated here, right?
That's correct, yes.
Thank you so much. And how many of these patients comes from Germany?
Up to now, we have grafted 27 patients with multiple sclerosis coming from Germany.
Wow. And which number of patients? And I'm 27, right?
You are patient number 27, that is correct, yes.
Great. So dear doctor, I have spoken with 11 fellow patients here in the Center of Outpatient Residence, and I was very surprised that they are all reported being strongly warned against the HSCT by their neuros beforehand. There was statements such as, first, they will come in a body bag, true horror scenarios. I cannot believe, but they was all afraid and they was all very confused. What could be behind these warnings, and why do neuro react this way?
Well, I think that the main reason is ignorance. Physicians from different parts of the world do not know that HSCT is the best treatment for patients with multiple sclerosis. The results of HSCT in multiple sclerosis all over the world are around 80% response rate, 80. Now the results employing any one of the novel drugs for multiple sclerosis is 50%, 50. So 80 is better than 50 in any part of the world. The reason why they do not know this is because they have not been reading the updated literature about this point. That's one point. The other one is that some physicians in different parts of the world prefer not to send the patients for transplant because they will lose the patient. I mean, the patient will not see them anymore, and the patient will not employ the expensive novel drugs employed for the treatment of multiple sclerosis. So this is a combination of both ignorance and then personal attempts to improve their economy, and this is very sad.
This is very sad, I agree. I was self-paid coming here. My decision was done 2 months, and then immediately I come here, and this is my best decision ever. And what do you think? What could be more behind? Can you explain maybe my idea with the economic conditions, maybe with the pharmacists, with the doctors, or is there any connection? Do you know this?
Well, that is a complicated question. There are papers already published that indicate that HSCT is, on the long term, more affordable than the employ of novel drugs for the rest of the life of the patient. So if a person's dealing with economic aspects of these treatments could be properly informed, they would choose HSCT as the best approach to treat the patients. Not only the economy, but also the results. The quality of life is improved in these patients. And all these things point to HSCT being the best treatment option for persons with multiple sclerosis. Initially, HSCT was endowed with a very high complication rate. 25% of patients given HSCT could have a complication. These figures have totally changed, and in our experience, the chances of having a complication, a fatal complication, is only 3 patients out of 1,674 patients, which is very low, and the complication rate is less than 10%. So HSCT has become a very safe procedure. It is also very effective, and as I said, it is cheaper than employing the novel drug. So this mixture of the behavior of drug companies, certain physicians, and so on, is what makes some people in different parts of the world defer the suggestion of giving an HSCT to a multiple sclerosis patient.
Thank you so much. Do you have contacts with clinics in Germany, and is there any exchange between you?
No, we don't have contact with clinics in Germany. We have contact with patients from Germany, and it's interesting to point out that the patients are the ones who decide to come to have HSCT despite the suggestion of their physicians in their countries, which, as I said, stems from very many reasons, not precisely medical reasons, and not reasons in the best interest of the patient.
Wow. So this must be improved. I think the doctors from Germany must come to here to learn. Well, okay. I have PPMS by myself, and I tried to get a HSCT University Hospital in Mannheim. I was told also HSCT is the most potent treatment available in medicine. It is the last treatment option and is associated with a very high risk, and only tried if, for example, Ocrevus is not effective and the patient has a little prospect of a normal life. What do you think about this?
Well, HSCT is a very safe procedure by now. Your chances of having a complication during the transplant are less than 10%. And as I said, the fatality rate in our experience is very, very low. This is number one observation. The second one is HSCT should be the first therapeutic option for the patient. We have shown and published that if you do the transplant very early in the course of the disease, the long-term results are better. And this is logical. I mean, if you do something to change the natural history of the disease very early, then your chances of having good results are higher. If you wait to have complications of the disease, the transplant will not be useful. In our experience, the response rate of patients given an HSCT is around 80%. And in the specific case of Ruiz, the best response rate published all over the world is 50%. And as I said, this is substantially lower than the results with the HSCT. Not only in our program, but in all the HSCT programs all over the world.
Thank you so much, Dr. Ruiz. Thank you so much. I will now continue my Finnish in German. And ja, was soll ich dazu sagen? Also die Zahlen sprechen eindeutig für die erste Option HSCT hier in Mexiko. Ich habe davon gehört, ich kenne sie nicht persönlich, aber die Klinik in Moskau. Aber ganz ehrlich, wer will jetzt schon nach Moskau? Ich möchte die Doktoren auffordern, ich möchte die Doktoren bitten, ich möchte unsere gesamte Ärzteschaft bitten, ihre Verantwortung bewusst zu werden. Ich möchte die bitten, diese Option HSCT als erste Option für die Multiple Sklerosis-Leute einfach auf den Tisch des Hauses zu legen. Diese Information muss viral gehen, diese Information muss bekannt werden und ich werde dafür sorgen, dass genau das in Deutschland passiert.